there you are. Yes, waiting ever so patient for you. Yes, nice to see you again. How have you been since we've last? You been okay? Pretty good? Okay, that's good. We're going to do obviously cranial nerve, as you well know. Yep, I'm going to start straight away, so if you don't mind, if you could stick your tongue out for me. Yep, keep sticking it out. And wonderful, put your tongue back in your head, well done. And in a moment I'm going to be asking you to press your tongue into your cheek. Okay, but I'll not be in tongue in cheek when I say that. Alright, and I'm going to be pressing very gently my hand against your cheek. I want to feel your tongue against your cheek, against my hand. Does that make sense? Yeah. You know by now, you've done this a few times, so yeah. Alright. Struggling to get my gloves on as usual. Not the most professional look, admittedly, but we'll persevere. Okay, so yes, so if we can start on your left side, is that alright? Alright, so if you can press your tongue against your left cheek and against my hand. Press, 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 press. Wonderful, very well done. We'll do the same on the right, if you're ready. You ready? Okay. So press into your right cheek, press, 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 and relax, well done. Make a few notes, you know how it goes by now. And yeah, you did really well there. Okay, so good tongue action. Alright, that's fine. So I want you to shrug your shoulders as high as you can and relax. Good. Okay, keep them relaxed. Okay, and shrug your shoulders again. Now keep them up. Okay, I'm going to be pressing down because I'm very, very mischievous like that. I want you to keep them up by your ears. So here we go. Keep them up. Keep them up. Keep them up. And there we go. And I was pressing hard then, and you were still, yeah, very good. Good shoulder strength. Excellent. Okay, let me quickly have a look in your mouth. Okay, so you can open your mouth nice and wide and say ah. Keep saying ah. Okay, just looking at the symmetry in the back of the throat. That looks good. Well done. Okay. You're pressing around your jaw. Let me know if it hurts. Okay. Even if it's a little bit uncomfortable, do let me know. Okay, don't hurt you. Not even a little bit. Okay. All right, here we go. So just relax your chin. It's wonderful. That feels all right. Yeah, it's not unusual to get things like swollen nodes and glands and things. Yeah, that feels okay. Okay, I'm just going to hold your neck on the side. Okay, I'm not going to be strangling you, don't worry. I mean, there are some patients I want to strangle, but that's besides the point. And I want you to swallow in your own time. I'm basically just going to be feeling for that swallow action. Okay, so swallow in your own time. Okay, that's great. Yeah, that's fine. Alright, you're doing super duper well. Okay. Good. Okay, just a quick check. If you could just cough in your own time as well. Okay, that's fine. Yeah. Yeah, sometimes I ask patients to cough and they just sputum just, yeah, it's projectile sputum. Okay, so I'm going to be doing a quick sort of whispering hearing test. Is that okay? I'm going to be covering over one of your ears and whispering into the other. When I've whispered, I'm going to be looking at you. When I look at you, I want you to repeat what it was. And I whispered into the ear. Okay, you got this. Alright, so I'm going to cover over your right side first of all. Okay, so let's get close here. And cover the right. Submarine. Good. Okay, two more. Dog. Okay. River. Good. Now we'll move on to the next step in the hearing test, okay? Good. Okay, so this is using the tuning fork, okay? Yes. Some people find this very relaxing. Yeah. okay, I've actually picked up the wrong tuning fork, because there's a much nicer sounding one that I'm going to get, because you're worth it. Okay, so let's put this one back and I'll grab the other one for you. Okay, it's got an extra while, see, my favourite patients. Okay, so this resonates at 528 Hertz, which basically means it makes a high pitched sound, so it's a little bit nicer than the low pitched one there. Okay, so I'm going to hit this with my pinger that I totally do not ever lose, and it's going to make a nice high pitched sound. Okay, first of all, I'm going to be placing this on the centre of your forehead. Yes. Quite a bit cold. Like I said, I've got an extra mile. Only for the people I like. I don't like that many people, to be honest. Right. So on the centre of the forehead, I'm going to be hitting it. It's going to make a sound like so. And basically I need for you to tell me, does it sound more or less the same on one side as well as the other? So if it sounds really loud on one side and really quiet on the other side, let me know. Okay, so it should sound more or less even each side. It's a little bit different. It's okay, because sometimes we have one ear that works a little bit better than the other ear. That's fine, but it's when it's massively different between one side versus the other that's when we may have to investigate further. Alright, so with that massively complex description, I think we're ready to begin. Okay, might be a bit cold. Okay, you're brave, you can do this. Got this. Here we go. Centre the forehead then. Sorry if it's cold. Okay, listen good. Did it sound more or less even through both ears? Alright, we'll do this again. Alright, we're going to be properly thorough. Here we go. Centre the forehead. That's a nice sound, isn't it? Was it more or less even? Okay, yeah, fantastic. Okay, I think we'll leave it there for the tuning fork. Sometimes I like to do 2 tests, but since we've tested you recently, I don't find it's absolutely necessary every single time. Okay. How are you doing? Feeling okay? Happy to continue? So, quick minute. We're going to do some facial expressions next. This is the fun part for me. It's where my patients look absolutely ridiculous in the name of investigative science and medical study. Okay, so we're going to do the facial nerve, cranial nerve number 7. Okay. So, if you could raise. I'm thinking pay rise is what I need. That's another subject altogether. If you could raise your eyebrows for me and keep them raised. Keep them raised. You look ridiculous. Keep them raised. No, just kidding. You look absolutely magnificent. Fantastic. Okay, I want you to close your eyes in a moment. Not now, because that would be a bit silly. I want you to close your eyes in a moment, and I'm going to be trying to open them because I am a very, very, very much a rascal. Close your eyes for me. There we go. And don't let me open them, don't let me open them, don't let me open them. Fantastic eye strength, stroke eyelid strength, stroke lower lid strength. Yep, okay, that's good. Okay, if you could puff out your cheeks for me. That's it, your best pufferfish impression. And relax. And now I want you to do that again, and this time, because I'm such a rascal, I'm going to be pressing the cheeks in, trying to dispel the air. And I want you to keep the air in your lungs, okay? In your lungs? In your cheek? Yes, I think it's time I had a break, but we'll persevere with you, and then I'll take a much needed break because I'm not making much sense at the moment. Okay. So if you could puff your cheeks out and don't let me press them in. Keep them puffed out, keep them puffed out, keep them puffed out. And you look absolutely adorable and relaxed. Fantastic. Good. It's fine. Okay, if you can give me a big teethy grin so I can see all your wonderful and unique looking teeth. Keep it nice and wide. Lovely. Good. Okay, have you noticed any changes in taste recently? I don't mean your fashion taste or taste in music or art. Okay. Have you noticed your hearing sounds any louder than usual? I said, have you noticed... Bad joke. Okay, that's fine. That's absolutely fine. Well, I'm going to physically inspect your ears. Okay, so I'm touching around them. So it's okay. Is that okay? Fantastic. Right, I'll try not to tread on your shoes. I'll keep them all. Otherwise scuff them. Okay, so I'm just going to fold it down the ear here. Let me know if it's any in pain. Okay. There we go. Does that feel okay? Okay, I'll do the same on the other side. Just fold them down top onto the ear. Shouldn't feel any pain. Does that feel okay? That feels okay. Alright. Just going to very gently squeeze the lobule, okay? Just checking for any build-up of any pus or liquids or anything that shouldn't be there, okay? So I'm going to be very gentle, so if, because it is quite fairly common to get some sort of build-up, so if I press too hard it's going to hurt. I don't ever want to hurt you, so here we go. Squeezing on the lobule. Does that feel alright? Okay, that's wonderful. And on the other side. Does that feel okay? Okay, that's fine. I'll make a note here. Do a couple more quick checks. Okay. Right, just a quick check behind the ear. Okay, so just stay as you are. That's fine. Okay, that looks fine to me. Yep, that looks wonderful. Okay, just keep looking forward for me, please. You're doing really well. Okay, you're doing really, really well. Alright. Super proud of you, as always. Now I'm going to be pinching on the ear, okay, because I am trouble. Obviously you're going to feel a pinching sensation, that goes without saying. However, if you feel like a massive surge of pain, please don't kick me. Just tell me, okay? I'll build up the pressure gently, so if it gets worse, if you get a big, massive amount of pain, just go ow or let me know. Again, if you could refrain from kicking me or near me. Okay, I appreciate that. And no biting or anything like that. Okay, there we go then. That feels okay, yeah. Okay. That's a relief. Okay, I've got to do the other ear because we have two ears after all. Okay, I've got to get the right point, there we are. Any pain? Okay, just a pinching sensation, but no actual ouchies. Right, that's good. Okay, so I'm going to check out one of the jaw of yours. Okay, so I'm going to be feeling around the temple first of all and asking you to open and close your mouth. Is that right? Yes, your jaw, rather. Mouth, jaw. Much of a muchness. Okay, so yeah, just relax your jaw at the moment and open your jaw for me, nice and gently. There we go. And close your jaw. That's wonderful. Relax again. Okay, any pain? I'm doing that. Okay. Right, if you can open your jaw nice and gently. Good. Okay, and close your jaw. Okay. Alright, that's fine. Okay, jaw jerk reflex type. Using the ridiculously sized jaw jerk reflex hammer. So I'm going to be placing my finger on your jaw. I'm going to be giving my finger rather a hit, not a big swing or anything. I'm sort of gesturing like I'm playing baseball, but it's just a fairly slight, like a swing the wrist, and just against my finger, the actual jaw. Okay, and I'm looking for that sort of jerk reflex that's similar to the knee. You only hit a knee and it kicks. Yes, so your jaw will kick, but not so dramatically, so don't worry about that. You're not going to knock me out with your jaw or anything like that. I mean, it nearly happened once, but again, that's another story. Okay, so all you have to do is stand there and look pretty. Yes. Okay. So keep your jaw nice and relaxed. Okay. Let's see, relaxed look. That's fine. Okay, so nice and relaxed. Okay. Yeah. So it's got a little sharp shot. Yeah. Okay. Now again, I'll try my left hand this time. I'm pretty good with my left hand, unlike some people I know, but yeah. Okay, stay nice and still, okay. Good. I've never missed with my left hand. I mean, not, you know, unless it's on purpose. Okay, we do a very quick follow the finger test, okay? So making sure you're in the right distance, there we go. And I want you to follow the tips of my fingers, keeping your head nice and still, and just following the tips of my fingers, there we go. That's good. Good. Okay, well done. You're doing really, really well. And there we go, simple as that. Good. Okay, we don't have an Ishihara chart to test for colour blindness. That'll be another day. Yes. Okay, any double vision during that follow the finger test? Okay, so you're not seeing two of me because that would be quite scary, wouldn't it? One's enough. One's enough. Okay. Okay, some quick trigeminal nerve testing now. Okay, we're going to do a sharp and a soft test, and yeah, this is a real test, and I'm going to start with this soft. Okay, I'm going to brush this across your face so you know what it feels like. Okay, unless you tell me otherwise. I hope I'm reassured you. Your trust is very much appreciated. Thank you. Okay, so this is how it feels. There we go. So it's the soft feeling. Yeah. So I'm going to be brushing across the face 3 times on this side, 3 times on this side, and then I'm going to be asking you, did it feel soft each time? So did it feel the same each time, pretty much? And also, did it feel the same on each side, more or less? Okay. All right, are you ready? Okay, let's go. Okay. So did it feel soft each time? Okay, fantastic. And did it feel more or less the same on one side versus the other? Again, like we did with the hearing test, if it's a little bit different one side than the other, that's okay. But we're looking for any massive discrepancies between one side versus the other. So if it felt really gentle on one side and normal on the other, so the gentle side you barely felt, for example, then we have to investigate further. Otherwise, if it's just a small little bit of change, we don't, you know, investigate. So with that long explanation out of the way, did it feel more or less the same? Yes. Good. Probably could have done that, yes, a little bit sooner, to be honest, but it's okay. Fine, okay, and that's fine. We're going to do the same with the sharp. Just a pair of tweezers, don't worry, I'm not going to be in. Yeah, it's fine. That's what it feels like. Alright, I probably should have asked you first if I could brush a sharp object across the face. We've kind of built up that trust now, haven't we? So we're comfortable with each other now. Yeah, semi-comfortable. I'll take that, that's fine. Again, 6 strategic places, very strategic, very important, very necessary tests. And then I'll ask you, did it feel relatively sharp compared to the soft Q-tip? Okay, or cotton bud, depending on what part of the world you're at. Okay, I digress. So here we go. Thank you for the trust, and now I have to ask you, did it feel more or less the same on both sides? And did it feel sharp each time relative to the soft Q-tip, cotton, or bud, cotton tipped applicator, cotton bud? Okay. fine. I'm not doing Ishihara, that's fine. Okay, we'll do a quick combination reflex test. If I can find my lid, there it is. Okay, so again, just looking forward. And I'm going to be placing my hand here and just checking on the response on both eyes, the consensual pupillary response, as we call it. That's the posh term. Okay, we check on the other side. But you're doing really well, okay? Everything is good, everything is wonderful. No issues, and don't worry, don't be anxious. Just be yourself. You will do amazing as you are doing right now. Right, so that's that. I'm going to make a quick note and do our 2 more tests. Obviously, we can squeeze in a couple more. But yes, I definitely need a break. I'm not saying you're hard work or anything, it's just that I am getting rather tired, and yes, a cup of caffeine beckons. Okay, that's fine, I've done that, that's fine. Okay, any changes in smell at all? Okay, so I'm just going to check in the pupils alignment. Okay, so yeah, just looking at it anywhere you want to is fine. Okay, just keep looking forward for me now. That's wonderful, keep looking forward. Okay, that's great, and again looking forward. Okay, one more test now. If you can just look at my wonderfully straight and not at all wonky nose, and not at all big nose. There we go. Okay, keep looking at my nose. Okay, I'm going to tiptoe here because you're rather tall. And again, if you can look at my nose the best you can without looking at my nostrils. Alrighty, so that's that. I'm happy with that, I'm happy with this. That's fine. Okay, we'll do a quick combination reflex test. Okay, so yes, I want you to look at this. Totally not a raspberry, it's a strawberry. Okay, it's not a raspberry, don't worry. So look at the strawberry. Yes, and if you can look at the back wall. Okay, back at the strawberry again. Okay, and I'm going to be moving the strawberry here because I'm such a naughty doctor. And if you look again at the strawberry for me, keep looking at the strawberry. Okay, now look at the back wall. Anyway, on the back wall is fine. Okay, I'm going to move the strawberry again. Okay, look at the strawberry again for me, please. And now if you can look at the back wall. Alrighty, and take a nice break. Good. Okay, one more test I think we shall do. Okay. So just a quick look into the eyes, okay, using the ophthalmoscope, which is this wonderful gadget here. Okay, so this will be a bright light, and I will warn you when I'm about to shine into your light, into your eye rather. Yes, that caffeine is needed. So I'm going to be shining bright light into your left eye in 3, 2, 1 now. Oops, wrong way, there we go. Yeah. And we're done. I'm going to be shining a bright light into your right eye in 3, 2, 1 now. Fantastic. Yes, I'm making a lot of sense right now. I'm owed you a break, so, you know, you can let me off this one time. Thank you. So last little notes here, you're free to go. And if I was you, I'd get out of here pretty quickly before I get any more cringe worthy. Yeah. Okay, well it was an absolute pleasure to see you. As always, take very, very good care of yourself. And no doubt we'll see each other again very soon for yet another cranial nerve exam.